Or you
So, I know we've done this before, but still, like, can you introduce yourself for the audience?
Absolutely. Thanks so much for having me on, Eric. It's my pleasure to be with you again, share with your community. I'm Dr. Evan Osar. I'm by training, I'm a chiropractic physician, but I started out as a personal trainer when I was in college. So, personal training and training in general has always been near and dear to my heart and doing a lot of movement assessment. So we do a movement assessment, and then I've written some books on corrective exercise. So you can find me again at Discover IMI, so Integrative Movement Institute on Instagram, and or you can look me up on Facebook, just my name, Evan, Evan, Osar, Osar, if you want to reach out to me directly.
Nice, nice. So, uh, personally, I use like the SFMA
Hmm.
assessment
Hmm.
system, or
Hmm.
sometimes use SFMS, but SFMA is more thorough, so I like that.
Sure, sure, sure,
But I know there's like different assessment.
sure.
So what kind of like is it a systematic assessment you use, and what is that?
Yeah, so we use the integrated movement system approach. And again, if you look at a lot of us that are out there, you'll see a lot of overlap with the way we assess because again, we're looking at many of the same things. We're looking at postural alignment. We're looking at just gross movement. Are you able to move well? Can you rotate your head? Can you bend forward? Can you stand on single leg? Can you squat? And then that leads us into some of our deeper assessments, or more specific, I should say, more specific assessments. And again, people are like, oh, that's just FMS, or that's DNS, or that's XYZ. It's like because a lot of us are looking at the same thing. So everybody has their own system. I've been blessed and fortunate to study with a lot of amazing individuals. I've been highly influenced by DNS. You'll see a lot of DNS in some of the things that I do and say. And I've been influenced a lot by my mentors, Dr. Diane, I should say Diane Lee, a physical therapist out of Canada, as well as Dr. Linda Joy Lee, both of them out of Canada. So you'll see a lot of their approaches. I've been influenced by Shirley Sarman. So you'll see a lot of these people will say, "Oh, that's just Shirley Sarman's work." I'm like, it should look like Shirley Sarman's work because she influenced me. So I don't think it's so much taking, thinking about this 100% unique novel approach. It's really about looking at what's out there, taking what makes sense to you, leaving some of it behind, seeing where a lot of the great minds overlap, and then, what is comfortable to you based upon your knowledge, your skill set, and the way you want to work with your clients. You'll see, like I said, you'll see a lot of different types of assessments, and that may look similar to what other people are looking at. At the end of the day, what we're looking at is, can the person move? Like, what is their movement strategy? And what can we do as movement therapists or movement specialists to help them optimize, not make them perfect? And we can talk about that at some point too. Not make them perfect. We're not trying to make them perfect. We're trying to optimize their performance. You and I were talking just before we got on here that you're a basketball, trainer for the basketball team, right? So you're not trying to make these athletes perfect. You can't make them perfect, but you're trying to optimize their performance. So if we get closer to perfection, you're going to help them optimize, but we're not trying to ultimately strive for perfection because that's impossible.
Nice, nice. So one thing, maybe it's me, maybe it's I don't have like enough experience for like assessing athlete or like
Sure.
uh helping athlete, but one thing I notice is like for sprinters or for basketball athletes, I know a lot of them have like a pelvic obliquity or like and I don't know which one come first, but usually they come with scoliosis.
Sure.
So this is me, a person I kind of like don't know how to help my athlete with uh scoliosis, pelvic obliquity, because sometimes it come with low back pain,
Sure.
sometimes it's gonna come with groin pain or like abductor weakness or can't feel the glute. So when we uh when we're dealing with pelvic obliquity or like scoliosis, how can we start?
Yeah, so there's several different approaches. Some of the approaches have become pretty popular recently, like PRI. They talk about how like everybody's got the same pelvic obliquity and because of the asymmetry in the body, and so everybody needs to like I don't even know what the protocol is, but like you know activate one adductor and activate the opposite abductor. I don't follow them that much. I've just heard about their approach. To me, we're always looking at, and again, it's going to be very similar to many of the approaches, but again, it's just a specificity of how you look at it. When I'm looking at an athlete, just say, for example, like a sprinter, sprinting, for example, is a very, pretty it's just a sagittal. That's the wrong term. It's pretty straightforward, right? There isn't a lot of deviation, or lateral movement or rotation type movement outside of that rotation that occurs during sprinting. So when you start to look at asymmetries from side to side, people will say like, "Oh yeah, everybody's asymmetrical." I'm like, but then how asymmetrical will help you? How much can somebody be asymmetrical before it starts to become a detriment to their performance? And that's what we're always looking at. And there's no determinant to what that number or what that amount of asymmetry may be. So I'm trying to, like, when I look at somebody, I'm trying to minimize asymmetry. So let's take your example of pelvic obliquity. So whether that be a rotation, like an intrapelvic rotation, where one side's going anterior and superior, and one's going posterior and inferior. So let's just take that for example. Well, then I want to see like, okay, why is that pelvis in that position? Is it something to do with the pelvis itself, or is it relating, or is that responding to what's happening down at the ankle foot? Is that responding to something that's happening above it at the head of the neck and or rib cage? So to simplify it and break it down, the first thing I'm going to do is I'm going to look at what we refer to as a thoracolpelvic cylinder. How is the rib cage aligned and stacked over top of the pelvis? That's the first place I'm going to start. Is the rib cage, because generally speaking, if you have a pelvic obliquity, so you have this intrapelvic torsion, and just say the person's rotated to their left through their pelvis. Well, unless they do something to their rib cage, or I should say, unless they don't do something to their rib cage, their whole rib cage will be rotated to the left as well. But you don't see a lot of people walking around looking like this, right? It's not very effective for an athlete, especially, right? So they'll do something to their body to then rotate back so that their eyes are level to the horizon and that their eyes are straight forward, relatively speaking. Now they'll probably do something through their neck, they'll probably do something through their knees, ankles, and feet. So the first thing that we're looking at is just general scan. Like where is a person? Where are these rotations? Where are these other asymmetries or compensations that are happening through their body? Then we're trying to do is like hone in on like, okay, what's that one thing that is driving that pelvis to be in that oblique sort of position or have that intrapelvic rotation? So is it a pelvis itself issue that's driving everything else, or is it the ankle and foot? Is it the thorax? So to make it simple, just for sake of this conversation, otherwise it takes us all into the weeds too much. Let's just say it's a rib cage issue, okay? So the pelvis, let me see if I can put this down a little bit. So just say the pelvis has gone, this direction. Well, then the lower rib cage generally follows where the pelvis is going. And then somewhere around here, mid thorax to upper thorax, you're going to get some kind of counter rotation. So what we're going to look at is like, okay, where is this person counter rotated? And then can we do something from a myofascial standpoint, from a maybe actually something that needs a joint manipulation? Is it something from a motor control standpoint? Generally speaking, it's all three, right? There's some kind of motor control aspect to it. There's something that needs to be released. There's something that maybe needs to be adjusted or manipulated. But what can we do then to unwind this person? Because again, we think about it as being wound up, right? Because the person is trying to keep his eyes level to the horizon. So it's the person's gotten themselves wound up. So wherever we feel based upon our assessments where the most amount of the significant area of that's driving the other areas. So say, for example, I'll just unwind their rib cage and see, and then have them march in place. Does that change the pelvis? I'll unwind the pelvis. Does that unwind and straighten up their rib cage? So I'm looking at how the relationship between the different areas, starting from that thoracolpelvic cylinder, the rib cage over top the pelvis. I'm going to start there. But again, you can't ignore the foot. You can't ignore what the head and neck are doing. You can't ignore what the shoulders are doing because, I'll give you a great example. Is I had a She was a high jumper. She was a Division 1 high jumper, and she kept breaking. She kept fracturing her fibula on her left side. So she's a right-handed high jumper. She's right-handed, so I think she pushes off. I can't remember. It's been a bunch of years now. But I think she basically jumps off her left foot last step. Well, she fractured her fibula, and then she came back a few months later, fractured her fibula again right above that, and then third time fractured her fibula again. And then when I was looking at, she'd been working with athletic trainers at the college, and seen some physical therapists. And then when I was looking at her, she had had labral surgery on her right side. So her right shoulder was lower, her rib cage was compressed, and she was kind of shifted over to her left side. So now if you think about it, if anybody's listening to this on a podcast, when you're standing up, just compress your right side and you'll feel yourself shift your weight over to your left side. Well, if you're already living your life over on that left side because of that right shoulder, that right rib cage being compressed, well, now you're going to keep overloading it during her sport, which is very, ultimately left side dominant because she's got to like, I hope I'm saying that correctly because they may train, high jumpers is like, no, you're completely wrong. No. But the fact was she kept shifting her weight to that left side. So our work initially was, yeah, there's some stuff we had to do down at the ankle and foot, but it's really about teaching her how to decompress her shoulder and her rib cage to get her weight more evenly situated between her 2 feet. So that's why a lot of times we're starting with that thoracolpelvic cylinder. How do I get the cylinder more aligned? Seeing how that impacts the ankle and foot, seeing how that impacts the shoulder, seeing how that impacts the head and neck, and then seeing which other areas are needing to be either released, adjusted, and or some motor control around that area. I hope that makes sense.
Yeah, yeah, nice. But like one thing I notice or one thing I talk with a lot of like physio,
Hmm.
they said is like if it's like scoliosis or if it related to pelvic, you fix one thing, the other thing is gonna automatically fix.
Hmm. Hmm. Hmm.
So is it like, hmm, is it important to like identify the main issue of that?
Yeah, that's a great point. If you fix one thing, will it fix the other things? In theory, yes. If you're very good at assessing and you're very good at playing off these different areas, right? So if you're very good at correcting the ankle and foot position and seeing like, hey, does that change my pelvic oblique, this athlete's pelvic obliquity? Is it changing their scoliosis or their rotation through their rib cage? Well, then you found what's driving the other issues. So yeah, most of your time should be spent down there. You may need to do a little bit of something up here, but most of your time should be spent down at the ankle and foot because that's what's driving these other areas. The challenge is you have to be really good at your assessments to figure that out. And obviously people have different levels of skills. Sometimes I'm really, really good at it. Generally speaking, I'm good at that because that's what I do and how I work. There's other times where it's challenging. It's challenging to figure out like what's driving it or what I think is driving it doesn't correct enough of the other things that I see. So it's sometimes it's easier just because it's so obvious, right? It's like, oh yeah, if I unwind the rib cage, everything lines up and they're good to go, and they feel they can squat, feel their glutes appropriately. Yeah, that's awesome. And other times it's like, oh yeah, I think it's their ankle and foot, so I'm working on the ankle and foot. Relatively speaking, better aligned, but there's still something off with the shoulder. So it may be there's a couple areas that are driving everything else in between because they've had this compensation for so long, or it's so hardwired into their body, neurologically hardwired into their body. So you may need to address a couple different areas. So I think that really lends itself to some of these situations where you have these athletes who have these chronic injuries, no matter how much rehab they do and how much physical therapy and chiropractic care and corrective exercise they do, the same issue keeps coming back. So it could be, the person's just not finding the right driver, or there may be like a couple of different areas that are driving it. Or it could be something like the eyes. The eyes are what's actually influencing, for example, because again, if you think about, your orientation to the to space to your life is keeping the eyes level to the horizon. So if your vision is off or your eyes are off, then that can also be another driver, which again is just something I'm delving into now and trying to incorporate more of.
Nice, nice. So, before we dive into the other topic, I want to like discuss more about this. I personally use like breathing. So when I like my scoliosis is like this.
Hmm.
So when I was back in Taiwan, my physio told me like if I'm gonna squat, I'm gonna breathe like this. Try to like expand my right side.
Yep.
So the bars on my back is more like even. And
Hmm.
then I used to like not able to feel my right glute, but after using this, I feel my right good glute.
That's
And
awesome.
when I sprint, my push off is better. So
Yes.
why exactly is that? And uh if the scoliosis is different, how are you gonna like is there other or breathing able to fix it?
So great question, and obviously you've had some good results with it, and that's been the findings that we've had with a lot of the clients and athletes that we work with as well. That yeah, if you have just to make it simple, if you have a lateral compression on your right side, well then yeah, you're not breathing into that right side very well. You're going to breathe more into your left side than your right side. Well then when you go to load that up, just say a barbell squat, an overhead press, something like that. Well now that external load is going to compress even more, making it harder for you to load that right side, use your glute appropriately, use your oblique chains appropriately. So you can see why it can decrease performance in your athletes, right? So if you breathe into this side, you probably need to do, especially if it's chronic, some myofascial release first, just to, through the intercostals, maybe through the external obliques, maybe even through the erectors to help the person get out of some of that lateral compression. And then, yes, breathe into it and be able to control that through load, through body weight, and then ultimately load. Why this works is because what actually stabilizes our, let's call it the cylinder again, so the rib cage over top of the pelvis. We hear about this thing called intra-abdominal pressure, and obviously that's been studied, and it's a real phenomenon. The pressure inside the abdomen is what helps to stabilize our spine. But it's not just pressure inside the abdomen, it's also pressure inside the thorax. And I haven't seen a whole lot of studies around performance and pressure inside the thorax. But if we think about intra-abdominal pressure, well, there's also pressure inside your thorax. Well, if you're collapsing on one side, well, now your pressure, the gradient's not the right word, but just the pressure around the cylinder is not going to be as optimal as it can be. So if we can optimize the alignment, get the alignment more optimal, now the cylinder's more aligned. Now we have a better chance to stabilize the trunk and spine and pelvis as well when we have that, especially when we have that external load, or we want to create that drive like you may do when you're sprinting. So it's just better. You get better pressure regulation when you have more optimal breathing, and that you can breathe into each region of the thoracopelvic cylinder. So it's not just belly breathing. And we've seen a lot of athletes in the Gen Pop that have been taught to belly breathe, and they're actually breathing themselves into suboptimal function because they're just doing too much belly breathing. They're not getting their breath into their rib cage appropriately, so their rib cage is actually stabilized. And we see that a lot with people that have chronic headaches because, again, when you think about you have your subclavian arteries that are going up to your vertebral artery and then perfusing your blood, the circle of Willis. Well, if your rib cage pressure is off, well, then the pressure going up into these blood vessels is going to be compromised as well. So a lot of people can develop chronic headaches as a result of that as well. So we can even help a lot of chronic headaches and neck tension by helping people better align that thorax and control pressure, ultimately controlling pressure through the thorax as well. So that's the biggest reason. And then the other reason is like once your alignment is better because you're controlling pressure better, well, now you have better activation through all those muscles, those oblique chains, through the posterior chain. To me, like, people focus so much on the posterior chain when they should just be focusing on getting the cylinder more aligned, getting better three-dimensional breathing or more optimal three-dimensional breathing, getting breathing into all regions like the thorax, the abdomen, as well as down into the pelvis, so they're controlling pressure more effectively. That is really what leads to better performance.
So, is that also the main reason that people are going to talk about like why breathing is going to have help us with low back pain, help us with range of motion, or like joint, is it called joint centration? Sorry.
Centration, yeah,
Yeah,
yep,
yeah.
centration.
Joint
Cent-
centration
mhm.
and activating the muscle.
Yeah, that's a great question. And yes, that's what I believe. I think it's pressure regulation, so you're not having to overuse all this other ways of. A lot of people become grippers when you don't have good pressure regulation through your thoracolpelvic cylinder. You're going to become a gripper. You're going to try to overuse shoulder depression. You're going to overuse gripping through your hips to help to stabilize that cylinder. When I say overuse, yeah, you got to use it when say you're doing a back squat. Yeah, you want your lats engaged. You want your glutes engaged. You really want to activate your glutes. What you don't want to do is not be breathing well. And now when you're activating those lats, well, now your lats are starting to compress down on your rib cage because you don't have a good ability to stabilize. A great analogy of that is, give me just a second. Is just using a stability ball, right? When the stability ball is blown up to its proper capacity, when you press down, it doesn't, yeah, it may deform a little bit, but it doesn't collapse down. So that's how I think about the thoracopelvic cylinder is when the thoracopelvic cylinder is aligned and you're breathing well, you're able to resist that vertical compression from gravity, from the contraction of your muscles, from external loads, very similar to this ball. But again, it's like a deflated ball. When you stand on it or put load through it, now it's going to deform very easily. The thoracopelvic cylinder is very similar to that. Now, the other thing is I've read a couple studies that have come out recently talking about breathing and why does breathing change? Like, for example, breathing has been shown to slower breathing rate has been shown to improve balance. A slower breathing rate improves actually ability to produce force. And what they conclude or what the authors suspect is happening is in the one study, they talked about how the motor control area in the brain for the diaphragm is very near this motor control area for the lower extremities. So what they suspect is like when you have better activation of your diaphragm, meaning you're using your diaphragm more fully and more optimally, so the whole diaphragm is working versus like just using. I mean, you're always using the whole diaphragm, right? Unless you're paralyzed or something. But when you're using it more optimally, so the diaphragm is going through a more full excursion that it should all the way from front to back, well, then it's also activating the very near area to it, which is the lower extremity. So now you have better balance. Now you have better ability to generate force from the lower extremities. So you almost get like a spillover effect from the effect of activating that diaphragm and being very purposeful about how you're using the diaphragm, which I thought was, I mean, like to me that's fascinating. That but again, it makes sense, right? The more optimal you function in more areas and more regions of your brain, you're going to get more sort of spillover effect to other areas of the body as well.
Nice, nice. I also, since you brought up like diaphragm, also noticed that uh coaches who are learning from the PRI, they're gonna say um they have the diaphragm is larger on the right side and smaller on the left. Am I right?
Yes, I believe I believe that's how it works. Yeah.
So larger on the right side, smaller on the left side. So people are gonna be uh there's gonna be asymmetry. And they also sell like
Maybe it's the opposite because
oh,
because you have the liver over here, so maybe larger actually on your left side.
okay, thank you. So larger on the left side, smaller on the right side. So there's going to be asymmetry. So, um, they use breathing to help it, right?
Sure.
So, while you teach breathing, how exactly do you introduce breathing to your clients to or to your athletes?
Yeah, great question. So we always want to show them, not just say, hey, go breathe because it's important, right? We want to show them that breathing actually has an impact on something. So we'll take some area of their body where they may have restricted range of motion. So maybe shoulder flexion, for example, or hip rotation. Those are just easy things that most athletes have, or enough athletes have trouble with. And if we can't find either one of those issues, then we'll find, maybe seated trunk rotation. Then we'll go through a little bit of myofascial release, very specific to where the athlete needs it. And then we also will use muscle testing, so range of motion and muscle testing. But the more, if I can get range of motion and muscle testing, just do like a lower trap, upper trap, or something like that. Just show them like, hey, you notice how you can't hold as strongly on this one side. So then I'll do the release, and I'll get them specifically breathing into that area and then retest. So show them their shoulder range of motion, show them their muscle test, and show them the difference. And have them like become real aware of the differences. Like really, like just breathing did that. It was like, yeah, it was getting your rib cage to be in a more optimal position. It was getting rid of whatever or decreasing whatever myofascial restrictions you had, and then teaching you how to breathe into that area so you have better pressure regulation. And now you have better ability to both move your shoulder or your hip and control. Your brain has a better ability to find and use that muscle and connect to that muscle because, again, the pressure regulation is more optimal and you're not compensating by trying to overuse. Like, for example, you're not trying to use your shoulder to help compress and stabilize your trunk as much. Now your shoulder can be in its more optimal position. So now your scapula stabilizers can fire up more effectively, or your hip stabilizers fire up more effectively. So now you can use your glute more effectively. So I want to show my athlete that it's having a change. Otherwise, they just blow it off like, oh, it's just breathing. I breathe all day long. Show them something that changes as a result of the fact that you had them do very specific breathing, and then give them a way to do it that's to go home and use it on themselves. So that way they start to own it and they can check themselves. And don't overdo it. Don't say, hey, go home and breathe for 20 minutes. I mean, that'd be cool if they did, but just say, hey, 5 minutes, take 5 minutes out. I want you to do this simple little release here. I want you to breathe and be real specific about your breath, recheck your range of motion, and make sure it's more optimal, and do that before you go work out because you want this to be reinforced during the athlete's workout as well.
Nice, nice. So you talk a lot about like we overuse belly breathing. We should probably like expand like three-dimensional. So
Correct.
um is it like the how do I say this? Is it like we need to like breathe in chest and the belly at the same time, move at the same time, or
Good question. Generally speaking, what should optimally happen is you breathe in and the chest relatively expands, and then it goes down towards the abdomen, towards the low as it's moving towards the lower lungs. And then as the diaphragm is contracting, obviously it's pushing down on the organs, and that's where you see the expansion through the abdomen and down and towards the pelvis. So it's kind of like a wave. It kind of waves down and then it waves back up. However, what we want to see is, how I discovered this was when I was, first learning breathing like 15 years ago or so, like really strategically learning it as a tool. I was just lying in my office, and I just had a hand on my abdomen and a hand here, and I was instructed to like, hey, just do belly breathing. So I was doing real good belly breathing, breathing in, breathing out. I'm like, oh, I'm doing great. But then I noticed, I'm like, nothing's happening in my chest here. And my chest seems actually very hollow. And then the more I started to look at more of my clients, I'm like, hmm, they kind of either they may be older and have that really big and wide infrasternal angle, big wide chest, or they were like me, like very hollow and shallow chest. But the one thing they had in common is like they're all belly breathing. I'm like, hmm, something's not right about this. Then I became more strategic about teaching myself how to breathe more, like you said, three-dimensionally, like around and focusing the clients. Because again, you think about the ribs are like rings. The rings need to expand this way. So you need to breathe three-dimensionally, get the breath all the way around, and it's not just about belly breathing. The people, you may see, I'm sure you've heard of Wim Hof and some of these other individuals. They use a lot of belly breathing or a lot of big breathing. I'm like, they're already breathing well, so it's like if you're already breathing well, you can do some of these other techniques and it looks like belly breathing because they're already using an optimal strategy. But for our general population or some of our athletes that aren't breathing well, just telling them to belly breathe doesn't help make it more optimal. It just reinforces a lot of what some of these people are already doing. So the real trick about being specific with your athletes is like evaluating their breathing, seeing where they're breathing well and where they could actually be their performance can be enhanced by getting them to focus on where they're not breathing so well.
Nice. You know what's fascinating? The last podcast we did is like a year and a half ago. And a year and a half ago, we talked about like movement assessment, psoas, shoulder. And today we talk about pelvis obliquity, we talk about scoliosis, but everything come down to breathing. It's so fascinating.
Right, right, because one of the things when you think about it from a musculoskeletal standpoint, right? What are the three biggest things that our nervous system is is focused on? Number one, breathing, right? Our nervous system is focused on keeping us alive. So that's the first priority. Second priority, keeping the eyes level to the horizon, right? Because again, that's our orientation to the ground that keeps us upright, helps us maintain our balance and center of mass. The third thing is center of mass. So center of mass over top our base of support. You know that as an athlete, right? It's like we need the center of mass controlled over the base of support. The better you do all three things, the better you breathe, the more optimal you breathe, the better you control your eyes level to the horizon, the better you have control of your center of mass over your base of support. Those are the athletes that perform the best almost every time. Not every time because there's always exceptions. You see the athlete, they're all cockeyed like this, and you're like, look at that athlete, they're the best athlete in the field. I'm like, yeah, there's outliers, right? There's always the outliers. But if you look at the best athletes most of the time, 90% of the time, they're the ones that have the most optimal breathing, the most optimal ability to keep the eyes level to the horizon, stack everything up, and then keep their center of mass over their base of support and do it really, really well.
Man, that is like, you summarize it like amazing. And when you say all those three things like breathing, eyes to the horizon, and the control of their center mass, yeah, it's like it's like when it comes to like basketball, it's like change of direction, acceleration, and step back. It's all about where you see, it's all about how you control the center mass,
Yep.
relate to your foot, relate to your pelvis,
Yep.
and it's all about breathing. Breathing is affect your shooting.
Absolutely. 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 And
Fascinating.
again, yeah, it's like it's really simplistic when you think about it. Now, getting your athlete to do that, not always so simplistic. However, if you look at the best athletes, that's what they're doing. That's what allows them to be super successful. Yeah, for sure.
Yeah. So, I know we've discussed a lot about movement assessment before, but as a practitioner, or as a like strength coach, as a sports scientist, there's like more and more like technology. We focus on numbers a lot more. We focus on data a lot more. Uh, so do you have like if a coach is gonna start, he's gonna start his career and he don't have like a lot of experience like watching or like assessing, how can they start to watch or how can they start to like appreciate movement?
Sure, that's a great question. And I don't think there's a number one right answer. I'll give you the best answer I have. Number one is just you gotta watch. You gotta put the hours in and just watch. And again, now even before that, so to speak. I mean, yeah, you can start that because it's easy, right? One of the easiest ways to do it is just because everybody's got a cell phone now. Start recording your athletes, with their permission. Obviously, you don't want to be the creeper guy with with the cell phone. Um, but start recording your athletes, and now so many programs have the ability to do that with fancy sort of cameras and things like that. But you have your mobile phone, so just use your mobile phone and just record and just watch, and then compare it to then go on YouTube or something like that and find some really good athletes. When I say really good athletes, like really optimal athletes, like what does a great way to a great way to start, for example, just for curiosity, not that you're going to teach everybody to clean, is just go watch somebody do a clean online, right? Just do a simple clean and catch, and just watch what the best in the world do with a clean. And it's just like you just look at it. It's like there's no wasted movement. You see all their joints aligned because Olympic lifters know that if I can't catch the load right here, if I'm not aligned, if my cylinder's not aligned, if my shoulder's not in the exact right position, if my lower extremity is not in the exact right position, I can't catch that load. I'm going to drop it, right? Those people just watching what they do, and then also watch what non-optimal or suboptimal lifters do. Compare the two, so that way you start to train your eye. Like, oh, I don't know what's going on. You don't have to figure out what's going on, but just notice the difference. Like, oh, that's what it should look like. It looks effortless because they're aligned in the right position. They're using the right motor control. They have the right pressure regulation. So it looks effortless versus someone who's trying to muscle the movement. And then what I do for myself is like when I do my posts on social media, obviously I'm filming myself, but then I'm looking at what I feel in my body and then what I notice on the camera. I'm like, ooh, that's not what I thought it looked like. I'm like, it looks like something completely different. And again, just start observing, just become real observant. And then you have to learn like what is optimal. And this is where I was just teaching in a master's program, an online master's program for people getting their athletic training master's degree. And one of the guys works with a collegiate hockey team up in Canada. And he's like, I hear you talk about optimal versus suboptimal. And, there's some debate about that. And I'm like, to me, there's not really a debate. It's kind of the conversation we started with earlier in our conversation. It was about like, yes, you're always going to have outliers. Like, for example, he showed me a picture of LeBron James' feet, and his feet look kind of like fandangled. And, you would not expect LeBron James, like the best athlete, in basketball, you know, right now, maybe, or in the past few years. You're like, well, his feet don't look optimal. They're not, he's got bunions and then they're all flat, the arches are flat. I'm like, but he's a genetic freak. He's an outlier. You can't look at all the basketball players who are all outliers in their own right and say, oh, see, their feet aren't right and they're performing at a high level. So why do we even care about foot health, or foot alignment? I'm like, because they're the outliers. And it doesn't mean he doesn't have issues. And you also have to look at the fact that these individuals, these athletes, they have people working on them every single day. So you can get away with suboptimal mechanics when you have somebody working on you every single day and you're training every single day and you're getting therapy every single day. It's a whole different world. It's not reality for the rest of us. So learn what's optimal. Where should the foot, because there's a study that came out a couple of years ago, and they looked at they had people stand on a platform and they put a little perturbation into the platform, and they took people who had a higher arch foot, so more supinated. They took a group of people that had a pronated foot, and then they took people that were more neutral, so subtalar neutral, and they compared which group reacted the quickest and had less perturbation when the surface was shook. The group that performed the quickest had the quickest reaction speed were the people that had the most neutral foot. So there's more and more. A friend of mine just sent me a study where they looked at blood flow to the toes, and they looked at blood flow to the toes when the foot was cramped up like this, and blood flow to the foot when the toes were straighter and more aligned. And the blood flow to the feet were better when the toes were more aligned. So there's more and more research that is coming out that is supporting that blood flow, neurological, like the nerves going to the feet or to wherever, in any area of the body, the low back, the lower extremity, wherever it may be, the shoulder. it's more optimal when we're more aligned. And again, not looking for this perfect position, but looking for this place where all joints are positioned in their most optimal neutral position. So that way you can move into and out of these positions and put the least amount of wear and tear upon the joints, upon the soft tissue, and put the least amount of stress to the nervous system itself. So learn what optimal mechanics look like and what optimal motor control should be. And then just keep observing. And then you start to marry these two things together and you get better and better at figuring out. Because again, it's one of the things that, for example, Usain Bolt's coach, he said when he first got Usain Bolt, luckily, he's the fastest guy in the world, but he said when he first got Usain Bolt, he had lots of injuries. And he's like, the first thing we started to do is start to work on his alignment. He's like, his alignment was just off. You think about the fastest guy in the world. It's like, yeah, he still had to work on his alignment. And when I say alignment, it's not just alignment because you have to control that. So it's alignment and motor control so that he performed at his best and ultimately became the fastest man in the world, right? So start out by observing, learn what optimal mechanics and motor control should be, and then start to marry that together. Go out there and learn from a lot of the smart people that are talking about this world. And obviously, you're always going to have the detractors who say like, "Oh, posture doesn't matter, alignment doesn't matter, motor control doesn't matter. Just go train them." And I'm like, yeah, you'll be if you got some outliers, you'll be successful, but you're not going to be successful with the athletes that struggle with suboptimal strategies. So, um, again, choose your approach, and this approach has worked pretty well for us. For a bunch of years, I've been doing this for 25 years.
I love it. I love it. I personally came from, I mean, I train athlete. I squat heavy, I deadlift heavy, whatever it is.
Hmm.
But what I know is, although I came from a different system, but what I know is alignment matters, like breathing, corrective exercise, assessment. That's gonna help us build up the most resilient athlete or
Yeah,
clients.
I agree. I agree. I 100% agree.
Yeah. So, man, this is fascinating. I love this. For those who are interested in what we're talking about today, where can they reach out to you?
Yeah, you can find me at my Instagram page. You can just DM me, and that is discover just the word discover IMI Integrative Movement Institute. So that's discover IMI. You can also find me on Facebook, Evan, my name, Evan Evan Osar Osar. And yeah, feel free to direct message me and I'll get back to you.
You